Looks like it started to pop. There you go. Yay.
Oh, here I am. I just got out of the shower.
There you go. Hi, Patricia. How are you?
Hi.
How was work?
Okay.
Hopefully not too bad. All right. Well, thank you for doing this for me.
Sure.
So I'm going to introduce you to my class because that's who will be watching this. This is Patricia.
Oh, somebody's watching us?
They will be.
Tell
They're
me
not
that.
watching right now. I'm going to edit it.
Okay.
I'm going to edit it. So they will be. So this is Patricia Atherton. She is a psychiatric mental health nurse practitioner. And I know you work at Palo Verde. Do you work anywhere else, Patricia?
No.
No. That's enough for sure.
Mm-hmm.
Keeps you busy. All right. So tell me about your work currently.
Currently, I work part-time as an inpatient psychiatric provider. I work 20 hours a week. I see patients on adult units, our acute unit, and then 2 step-down units. I'm trying to think how many it's an 84-bed hospital, but there's a adolescent unit with, I think, about 22 beds, and I don't see any of those patients. I don't see adolescents.
Have you always done inpatient type work, or have you done?
No, I have not. Mm-mm.
Okay. What other type?
This is new to me.
Oh, what other type of work have you done?
Let's see. I was a coordinator for a psychiatric day hospital.
Oh, wow.
I worked in an urgent psychiatric care facility adjacent to a hospital ER. So the patients who weren't admitted to the ER would come to the urgent center, and we would assess them and prescribe medication and get them hooked up with a psychiatrist.
Oh, wow.
I worked at Healthcare for the Homeless, and I actually worked as on the medical side, but you did psychiatric work as well. And then I also worked teaching psychiatric nursing at a college. And I worked at the VA in New Mexico in outpatient.
So you've had some really various experiences. That's really great. What would you say was your most interesting position?
I think probably at the VA, because I had a lot of interesting opportunities there. I was one of the first nurse practitioners to be able to administer electroconvulsive therapy.
Oh, wow.
I went to a training in Emory, at Emory in Atlanta. I also got to co-facilitate mindfulness meditation program with yoga, and that was really interesting.
That would be really interesting.
Yeah. So wearing a lot of hats.
Oh, goodness. How long have you been a nurse practitioner?
Let's see, since about 96.
Okay, okay. So when you think back to when you first started as a nurse practitioner, what were a couple of your biggest struggles you faced transitioning from RN to nurse practitioner?
Well, I think back then there was more resistance of patients dealing with a nurse practitioner. You know, you weren't as accepted as the physician.
Right, right.
And I still encounter that every now and again.
Absolutely, absolutely. So in Arizona, nurse practitioners have full scope of practice. Do you agree with that, or do you think there should be more restrictions on the licensure?
No, I agree with it.
Okay. And are there any changes you would like to see made in credentialing and clinical privileges for nurse practitioners at your current work at Palo Verde?
In my current job, well, we have the psychiatrist, the nurse practitioner nurse practitioners have this psychiatrist sign off on our discharges. But actually, at this point in my career, I'm not really that upset about it. I find it's kind of sharing the liability.
Sure. Sure.
So I'm okay with it. I know, I think there was a previous nurse practitioner who was really upset about that, but I don't mind. And in that job in particular, because I see other people's patients.
Sure.
I may discharge a patient I don't really know that well. I may have just met them that day.
Sure.
So I'm fine having another set of eyes, if you will, having them walk out the door. But from a financial standpoint, I'm not certain what the implication is.
Okay. Now, at Palo Verde, then it takes the psychiatrist has to agree with you with the discharge. What about with the admissions?
I guess that's the only other thing at that facility. Nurse practitioners aren't allowed to do the initial psychiatric evaluations.
Oh, okay.
Which is really fascinating because I ran an evaluation clinic for years.
Wow.
But it's also interesting because if you don't agree with the evaluation, right? It doesn't matter because if it's your patient, if it becomes your patient, then you just change the diagnosis and do what you want to do. But it's kind of interesting.
So the psychiatrist does the admission, the nurse practitioner can follow, and then at the time of discharge, you can discharge, but they have to agree with you. Is that correct?
Right.
Okay. That is interesting. That's definitely not that full scope like Arizona has.
No.
It's a little different.
No.
Now, do you consider yourself, because of that, do you consider that you're working in a more collaborative environment?
Well, yes, and especially in my current position, because 2 of the days that I work, I'm covering for psychiatrists who are out. It's their day off.
Okay.
So I will automatically get their patients.
So does everybody kind of rotate the days off and covering each other?
No.
No. Okay.
We have two physicians who are off Monday and Friday, and I are psychiatrists, and I cover for them.
I see. And you and the other nurse practitioners cover for each other as well?
I guess. I mean, I don't know. For example, I'm going on vacation and I don't know who is picking up. Well, what will happen is when I'm not there, any patients that I have typically go to the other nurse practitioner.
Okay.
But not necessarily, but pretty much.
Okay. Now, do you often collaborate with other professionals within your job currently?
You mean like the social workers and the nurses?
Oh
yeah, all the time.
Nurses, psych tech,
yeah,
social workers.
We meet every morning. The psychiatrists and the CEO and head of nursing and social work. We have a quick huddle, and then we meet with the social workers to discuss patients. And then we have a pharmacy in our facility, so our pharmacist is very involved, and the techs and the nurses, I always ask their opinion because they're there 12 hours a day.
And I know because I work there as well, the medical folks jump in there too, and they're available too.
So it's a team effort, and I actually like that multidisciplinary approach.
I do as well, for sure. Can you provide a clinical scenario in which you specifically sought a consult with any other professionals to help you in achieving a better outcome for your patient?
Well, okay. I had a very difficult 30-year-old male with schizophrenia. And he was also just he was labeled or diagnosed with schizophrenia. I'm not quite certain if that was accurate, but he was very labile. And one minute he'd be very stable, you'd talk to him, and then, you know, later in the afternoon, he would just be rambling, pacing the halls, talking to himself. And I did go to one of our psychiatrists. Actually, it was a swap. I said, would you mind seeing this patient? And I'll take one of yours because I really want a second opinion on this patient. And she said, fine. So we did switch patients. And then we met the next day, and she said, oh, I agreed totally with, you know, your plan and what you were doing. She said, I'll keep him though. So that was fine with me.
That's good. That's great that she was amenable to getting that second set of eyes and then jumping in when needed. That's wonderful.
Yeah. No, that's one of the great pieces of working at that facility. It's a nice group.
Absolutely. What would you consider your biggest challenge today as a nurse practitioner seeing patients?
I'm thinking biggest challenge. Well, you know, there's the whole legal piece. We have a court in our facility, mental health court. And as a nurse practitioner, I can petition patients, but I don't, once again, I don't do the evals. The psychiatric evaluations, you need a second. And I don't go to court, although I can be asked to testify.
I see. Okay.
So just that whole system is actually kind of new to me. So I guess that's kind of challenging because I wasn't that well versed in it.
Absolutely. There's so many nuances to anything with legal issues. If you were talking to new folks going into psychiatric mental health as nurse practitioners, whether they be from RN to nurse practitioner or from a different specialty like family practice to psychiatric practitioner, what advice would you like to share?
Well, I always said, you know, a lot of what we do is dealing with, you know, mental health issues with people, even when they're physically sick. It's a big component. What advice would I give? Listen to the patient. I mean, even though people are mentally ill, I think some people tend to write off what they're saying, but you know, you have to listen to the patients, even if they are unstable in the moment. There's always a thread of something that will lead you to a better diagnosis, and I think a better treatment. And I also think getting their support systems involved, if they have any, is really crucial too.
Absolutely. Well, that is actually my last question, Patricia.
Okay.
Thank you so
All right.
much
Well, I hope it was helpful.
letting me interview you. I really appreciate it.
Okay.
Thank you. I'll be seeing you.
Okay. Okay. Take care. Bye-bye.
Bye-bye.
Mom was very positive, JJ.